My name is Patrick Wasiu. I am a trainee health worker here at Napranum Clinic. I've started here 2012. Well, I think outside staff should know about one thing is the people in the community. Like before they come in, they should do a bit of research, like on the council website, population, what are the clan groups. A big thing that I see with outside staff is they need to understand the cultural protocols in this community as well, and that goes for any other community. A lot of communities have similar cultural protocols, but a bit different, and it is hard with outside people coming in, not just health staff, but other agencies coming into the community. Like if there's a death in the community, that's a big no-no. Sorry business, or if there's an event happening in the community, because at those times it's very hard for us to find patients or them to find patients to come up to the clinic. I think they also need to know who the elders are, especially the old people, and respect the community and the decisions of the people. That, a woman can talk to a man about specific stuff. It has to be just woman, or men's. Ourselves as indigenous health workers, we have to know ourselves of cultural protocol as well. What we can do and what we cannot do with particular people. For example, I myself, I can't go and touch an elder without asking for permission. That's just a cultural protocol. We can't go touch a person who's older than us in the head or anywhere like that. We can't look person eye to eye. That's seen as a threat. And there's particular ways that you approach people and the way you talk. So, for example, if an outside person coming in, looking at the clinic, they can't just walk into someone else's yard and expect them to answer the door. They have to know. Or ask a health worker, can you approach that house, because there might be something happening there. Whether it's sorry business or just family stuff. And the way you speak to people is also very important in communities. And the way you actually say it as well. There can be two words you can use in one sentence, but it's the way that you actually, the way you say it, or one word in two sentences. So, and it's the way you approach it. And also how to respect people as well. So cultural protocols, community elders, clan groups, population, different areas where they can go and where they can't go. For example, men's center here next door, women can't go there. And the women's center or shelter, a man can go there. And that's for us as well, for health workers. We just have to walk into a women's health clinic and ask for a lady. So we usually get a female health worker to go. And also talking in front of patients. Even though we as health workers, we are professional, we still approach a patient, if an elder of our community, we call them auntie or uncle. We can't just say out their name because it's sort of disrespectful. So stuff like that. Some doctors find it very difficult. So we always advise the doctors that take our health workers in, because we can tell you when to do stuff and not to do stuff. And some of the patients don't understand English, so they'll nod yes for everything they say, but this actually means no. So suppose they do attend I suppose they can ask the senior health workers or the health workers at the clinic, but I suppose they attend the cultural practice program. I think some staff who attended the cultural practice program 10 years ago, they have to do it, because I'm not saying culture changes, culture does not change, but specific things within the culture does change. You keep up with time, and that's the way that I see other staff, outside staff coming in to attend those cultural practice program, and they really have to take in account that people who are talking about the cultural practice program, who are facilitating it, are experienced or have knowledge, and if at any time the staff from the outside do feel, they want to ask a question, I think it'd be more good if they actually, bring up the cultural practice program facilitator or someone, who has knowledge, and also, talk to the senior health workers, talk to health workers, because the nurses ask health workers as well for advice on certain stuff, and health workers seem to know everything, I think. Some of us. Another issue is in Napranum we have a lot of traditional adoptions, so a lot of the families or the kids don't know their biological parents' history, as in health-wise. So they might be adopted to a family where their health is good as gold. Then they find out that they actually have diabetes or they have another chronic disease. There is a lot of young people that do miss out on a lot because there's a lot of stigmata behind coming to the clinic. So I suppose breaking the barrier between the age group or different generations coming to the clinic, and dealing more with young people health, as in having specified positions, I think, in the clinic to deal with young people, because you can't relate young people to older people when you're dealing with patients. And also having a male and female health workers is good. Because a lot of the boys do find it difficult to come in. We have a lot of difficulties in having men coming in, young men, but it does go down to a level where a lot of the younger generations are now coming into the clinic and finding out that they are diabetic. Some don't come until later on because of the shame factor. So sometimes it's a bit too late for them to turn back the clock. And